going to be graduating in 2 weeks from University of North Dakota with a degree in nursing. Besides my 4 years of education in the classroom, I also have over 600 hours of experience, clinical experience outside the classroom in the healthcare setting. In addition to that, I've also worked at Altru, the hospital in town, for about 4 years now as a CNA, an orderly, and a nurse intern. So even though I'm still relatively new to the healthcare and the field of nursing, I feel that I still have enough experience to tell you why that if you're still considering what profession you should do as a living, nursing might be an option for you. So the first reason why you should consider being a nurse is the job availability currently. According to the American Nurses Association, from the year 2012 to 2022, nursing will see a 20% growth. This means that in that 10-year span, there will be 1.13 million new nursing job openings. I know especially in today's current economy, job availability is an issue, and that will never be an issue in the field of nursing. Even with this growth over the next 10 years currently, there are tons of openings in the nursing field. In my personal experience, there's openings on every unit at Altru, and that's just working within the hospital. I was also considering moving to Ohio, and one of the hospitals there I was looking at, it's a bigger hospital, they have over 130 nursing openings. Another reason why you should consider nursing is the nursing salaries. The average nursing salary in the United States is $67,000 per year, and that's just with the 4-year degree. If you decide to go on to school for 2 more years to get either a nurse practitioner degree or a certified registered nurse anesthetist degree, the salaries increase significantly. For nurse practitioner, the salary is $98,000 per year. It's the average. And for the nurse anesthetist degree, the average salary is $140,000. And that's just 2 more years of schooling. I know at Altru in town here, the starting nurse salary is $26.40. And that's not even considering all the pay differentials you can have. If you work night shifts right now, they pay $4 more per hour. There's also a thing called incentive pay, and that means if they need nurses staffed, they will pay you $20 more per hour at Altru. So you can be making a lot more money than just the $26.40 that you start out with. The third and last reason I want to talk about is why you should be a nurse. It's just the service that you provide to people as a nurse. Health is our greatest asset. Without our personal health or our loved ones' health, nothing else that we own or do matters unless we have our health. And as a nurse, you get to help people get back to health. More so than I would argue more so than any other profession that is out there. As a nurse, we commonly work 12-hour shifts. It means you're spending, half the day with your patients. Whereas most other healthcare professions in the hospital, whether it's doctors, they might only go and see their patient for 5 minutes out of a day. But for the other 12, you're the ones that are the eyes and ears for the doctor. Any status changes, anything that's going on, you're the one that's, seeing this. You're the one that's in the room with them, reporting this to the doctor. One of the big arguments I would think people would have against nursing would be, just all the occupational risks there are involved in it, and that is true. There are risks with nursing. Certain fields of nursing see high burnout rates. Back injuries are very common within the field of nursing. Emotional stress of nursing. I mean, you work with really sick people every day, and it can be taxing on people. So that's definitely something that you need to consider. If is nursing for you? Are you gonna be able to handle the kind of stresses that are in the field of nursing? But I would argue that yes, nursing is a stressful job and there are risks, but there's tons of things you can do in nursing. So if direct patient care in a hospital setting isn't for you, there's many other job paths that you can take. When I looked it up, in different fields of type of nursing, you can be a case manager, you can work in forensics, you can work in informatics, legal. You can be a research nurse and do research, and you can also be a nurse educator. I know working at the hospital, for me, many of the people that are working in the desks and they're the administrators of the hospital are nurses. So that all being said, the 3 reasons why you should consider being a nurse is that you will always have a job. The pay is good, and if you go back to school, it increases significantly, and you will make a huge impact in people's lives.